Hey y'all, what's going on? This is Jackie Maria, J. Marie Booklist. So today I am making a video about how it is all hands on deck at a hospital in Illinois. So in Peoria, Illinois, there is a hospital, OSF Healthcare, St. Francis Medical Center. And yeah, it's real out here. So due to the rise in COVID cases as well as staffing issues, they have not been able to um, effectively run that hospital. I mean, so they doing everything that they can. So one, you had hospitals with the vaccine mandate, so you had people leave there. It was already a staffing issue before the pandemic. And then with the rising COVID cases among not only the general population but as well as the staff, because this Omicron that went around, it took out a lot of people, and so yeah, so they were having issues. So what they have done is they had office workers who left their desk and were working, in the non-clinical setting in the hospital. So you had Thomas OTT, who's the vice president of Treasury. He was doing housekeeping. Okay, so he came from his office that he has, like he's the vice president. Okay, he the VP of Treasury, and he was doing housekeeping. Like that's serious. Um, this article also talks about how people who were like secretaries, because like we do it here, we do it down here, that the if a person is a harm to themselves, they'll have what is called a sitter, and 9 times out of 10, the sitter is a CNA PCA, is a medical staff, but they did train the secretaries to, like, we had to take a CBL to learn what to do, because because when the patient is in the room, and if something happens, you're just secretary, you don't know what to do except run out in the hallway. But so what they did was they called it run in the hallway, scream for help. So what they did was they had us do a CBL on, things to look for, ways we can help them, because I mean, you have to know some things about the patient. If the patient should not be getting out of bed, you got to make sure they don't get out of bed, or if they need help getting to the bathroom. So let's say they can get out of bed, but they just need help. There are ways you have to be able to help them. The medical staff, the nurses, the CNAs, they would know what to do and how to handle them, but the secretaries, we wouldn't know. So they even had people who worked behind the desk doing that. So like I said, we already did that, but apparently there they don't do that. So they had to be trained how to do it. They also had to be fitted, like the office staff had to be fitted with N95 masks. Secretaries, I've never known a secretary to have to be fitted with N95, because 9 times out of 10, if a person is in that type of isolation, we're not going in that room. So like we'll go, we might go in the room, you gown up. This is before the pandemic. So you would gown up and put your gloves on, just depending on what type of isolation you're in. I made a video a long time ago talking about the different types of isolation. And so depending on the type of isolation, you will put either a gown on, gloves on, a mask on, just like a regular surgical mask. But we didn't go in no rooms where you needed to put on a N95 mask. We did not do that. Okay. So, but because now we're in a different time. We have a pandemic, and they want everyone to be fitted with a N95 mask. If you go into if you're in the hospital, they want you to be fitted. So you have people who had never worn a mask to be fitted if they're gonna work in the hospital. Now they've been in the office all this time, and now because it's all hands on deck, they are in the hospital, and they may be in that room, because like if you're working housekeeping, you're going in these rooms. You know what I'm saying? And you could be going in the COVID positive room. So yeah, it's real out here. I mean, I was reading this article and it was just I couldn't believe it. Now, this hospital sounds like kind of like where I started because they had walk-in clinics as well. So the hospital I started at a long time ago, they had the hospital. They had, different hospitals. They're all in the same name, just different locations. And then they had walk-in clinics. We had those. And then they had like the administrative office, which was in a totally different building. You will have that sometimes when it's a real like it's a big campus, it's a big hospital. You might have the administrative building. I'm sorry, the administrative offices in a different building. You may have that. So it sounds like this is what they had because the it's it sounded like they were in a different whole another location. So they weren't really you know, what was really going on in the hospital. If you're in a whole nother building during a pandemic, it's a whole different beast. You understand? You know what's going on, but you really don't. So that's what it sounds like, and especially they had walk-in clinics. I'm pretty sure that this is a big facility. I never heard of it, but that's just me. Um, so yeah, it's getting real out here. You can put in the comments below if you've had to do things, work other um, positions because it is such a staffing shortage. I'm pretty sure that most people are working, your position. You killing it on that overtime, or now you just burn out and you don't even care. But put in the comments below if you have worked doing other things, like they come to you to do other things. I know my mom, because you all know my mom's a nurse. She was working. I mean, golly, they throwing money. They is throwing money at at the nurses at her hospital because they need the help. I mean, when I say throwing money, I'm not even talking about the usual, you pick up a shift and you get an extra, you know, $10. No, it is like an extra $10, extra 400, 500. They getting bonuses. Like they just get y'all bonus. Like just for, as a thank you. They getting all kinds of money. I was like, hey, maybe I should have been a nurse. you know. But then again, but they get burnt out though. So they get money. They get money through at them. So but yeah, it's real out here. Like I said, I doubt that this is the only hospital. This is probably just the only hospital we don't heard about. But I'm pretty sure it's going on in other places. If you have any comments, you can put them below. You can also follow me on my blog, Jamie Reed Booklist. That's where I talk about being a unit secretary. And I'll talk to you later. Bye.